The male and female reproductive system is comprised of primary, secondary, and accessory organs that share the same main functions. They produce and store sex cells, transport these cells, and produce sex hormones.
The male reproductive system consists of testes, the scrotum, the epididymis, and vas deferens, which are systems of excretory ducts, the ejaculatory ducts, which are the seminal vesicles and prostate, and finally the bulbourethral glands and the penis. The main sex cell producing glands are the testes, which create a favorable environment for the sperm. During maturation, a sperm cell leaves the testes through efferent ducts that lead to the epididymis. The vas deferens is continuous with the epididymis. The vas deferens enlarges to form an ampulla, where sperm are stored. The ampulla join with a seminal vesicle to form an ejaculatory duct. Each ejaculatory duct passes through the prostate gland and empties into the urethra to be expelled. One major issue that can occur in the male reproductive system is infertility, which is when men are unable to conceive a child. Unfortunately, infertility occurs in about 15% of couples. Infertility can occur for several reasons, whether it be low sperm production, natural blockages that can prevent the proper delivery of sperm, or other abnormal sperm functions. There are many medical and environmental factors that can contribute to lack of sperm. Medical factors include infections, tumors, or hormone imbalances, while environmental factors include exposure to radiation and X-rays, industrial chemicals, or overheating of the testicles. There isn't one specific way to treat infertility, but sometimes a surgery may need to take place so that a varicocele can be corrected, or a vasectomy could be reversed. Other treatments include treatments for sexual intercourse issues and treatments for infections of the reproductive tract. Many couples may decide to obtain sperm from a sperm donor in order to have a child.
The female reproductive system has four major functions: to produce egg and sperm cells, to transport these cells, to nurture a developing fetus, and lastly to produce hormones. The system includes the ovaries, fallopian tubes, uterus, vagina, accessory glands, and external genital organs. Ovarian cancer is characterized by an abnormal division of cells in the ovaries, which are on either side of a woman's uterus. The ovaries are where egg production takes place in your reproductive system. The type of ovarian cancer depends on the type of the tumor. There are three. Epithelial tumors are a thin layer of tissue covering the ovaries. This is the most common tumor. Stromal tumors begin in the ovarian hormone-producing cells and are the second most common ovarian tumor. Lastly, germ cell tumors begin in the egg-producing cells. These mainly occur in younger women. Ovarian cancer has nonspecific symptoms in the early stages of the cancer. As the stages progress, the symptoms worsen but remain nonspecific, meaning that people with it may or may not experience it. Some of the symptoms can be pain in the abdomen and pelvis, bloating and nausea, abdominal fullness, and fatigue and loss of appetite. Ovarian cancer has two main treatment options: surgery and chemotherapy. In many cases, a hysterectomy is the main treatment necessary for the patient. A hysterectomy is the removal of a woman's uterus. Chemotherapy can be helpful in attacking the cancerous cells. Ovarian cancer is extremely serious, which is why it is important to know the risk factors. Some of them are an inherited gene mutation, a family history of ovarian cancer, and old age.
For a woman with ovarian cancer, her life is unpredictable. Ovarian cancer recurs in approximately 85% of women with advanced ovarian cancer. So of course, the fear of this reoccurrence is always on a survivor's mind. Ovarian cancer may also be particularly challenging for women psychologically because of the advanced nature of the disease at time of diagnosis. Ovarian cancer is frequently diagnosed late. This leads to an urgency in treatment, and therefore healthcare professionals take little time to consider to talk to the patient about the psychological aspects of their care. Along with this, the side effects of the disease repetitive cycles of aggressive therapy, and the perceived loss of femininity because of the removal of reproductive organs, as well as the very real possibility of dying, all contribute to poor mental health of women with ovarian cancer. This also impacts their family greatly. The National Ovarian Cancer Association reported that 79% of patients felt uncomfortable raising psychological and emotional concerns during their consultations, and this is a major concern, particularly because the psychological impact of cancer can also have a significant impact on treatment outcomes. Reportedly, 80% of women with ovarian cancer experience poor mental health, and patients with depression and anxiety are at a significantly greater risk of mortality, hospitalization, and poorer treatment outcomes. For all of this, it's important that women and their families access a variety of supportive care systems.